And I'm always on the lookout for interesting articles. And across Victoria and New South Wales, this one on Flow News 24 has caught my eye. The Victorian Opposition is critical of the withheld Mental Health Royal Commission report. Now, this is an interesting situation. This report was due to be released on Friday the 5th of February. The Andrews government has withheld it due to the unfolding COVID-19 outbreak at the Holiday Inn Medi Hotel in Melbourne's airport. Now, Victoria has since been placed into this 5-day lockdown. Now, this is why it's an interesting situation. The Shadow Minister for Mental Health and the member for Lowan in Western Victoria in coverage areas around Rainbow for us here at The Flow, Emma Keeley, has told us the 11th hour delay was bitterly disappointing for the Victorians who had shared their stories in an effort to lead desperately needed change in Victoria's broken mental health system. She further adds that vulnerable Victorians have waited years for change, but despite dozens of reports recommending immediate change by the Andrews Labor government, that there have been delays, excuses, and now this Royal Commission report not being released on time, and the reality of the crucial support that Victorians need right now. Meanwhile, the Rural Workforce Agency of Victoria has announced that it will provide support for up to 5% of the Royal Australian College of General Practitioners, the RACGP members, in rural Victoria to become Medicare-registered focused psychological service providers. That's approximately 100 GPs in Victoria. There's $103,000 of funding which will be fully subsidised, and the cost of GPs in rural and regional Victoria undergoing the Focused Psychological Strategies Skills Training. I guess it means that your GP becomes a little bit more trained in psychological study. And one doctor who heads up the RACGP, the rural chair, is Dr. Michael Clements. He underwent the training after a disaster struck his Townsville community. He says it made a real difference after floods there. He became a counsellor as well as a GP in the flood-ravaged city, and the training helped him be able to see patients and their psychological, their mental health supports that would be required. Rural patients often turn to their GP for mental health, said Michael, and he strongly encouraged GPs in Victoria to get this training. 100 of them will be able to do so. But why delay the report when, if there's 5 days of lockdown, or presumably we're being told that could even be increased, that they did book 2 weeks when the Premier put this edict in place. He said 5 days to the public, but actually booked 2 weeks out in terms of the paperwork. It's intriguing that right now they would have 5 days, politicians that is, to read this Royal Commission report. If it hasn't been released, then how is it that people who need to know don't get an opportunity to read it when, well, they would presumably under lockdown have had some more reading time? Is there a political reason why the Premier would delay putting this piece of valuable Royal Commission investigation back into the shelf for another week or 2? Or when is he going to release it? And why delay it? Is it because in the report it does refer to the mental health of Victorians as a result of the consistent and ongoing lockdowns that we've had under COVID-19? I suspect that given other states haven't had the same level of lockdown as Victoria, there may be some information in the Royal Commission report that the Premier wanted to delay while there was another lockdown.